Welcome to The Explainer. Today, we're jumping into something that's, well, it's a huge medical challenge. We're talking about wounds that just won't heal. We're going to break down the science of why this happens and show you the incredible systematic approach that's finally making a difference. So, why do some wounds never heal? I mean, it's a super frustrating question, right? For patients, for doctors, for everyone. You get a cut, a sore, whatever, and you think you're doing everything right, but it just sits there. It doesn't get better. So what's going on? Why does this amazing healing process that our bodies have just stall? That's the big question we're tackling today. Okay, so let's get on the same page. What is a chronic wound? The most important word to remember here is stuck. Yeah, stuck. It's not just that it's healing slowly, it's hit a wall. It's completely trapped in one part of the healing process and it just can't get out on its own. And figuring out why it's stuck is the key to everything. All right, so here's the first big, and I mean critical, idea you have to grasp. A chronic wound, it's almost never just a problem with your skin. Think of it more like a giant blinking red light on your dashboard. It's a sign, a warning flag that something deeper is wrong inside the body. And this is the perfect way to think about it. I love this analogy. Trying to heal a chronic wound without fixing the root cause, it's exactly like trying to mop up a massive flood while the faucet is still blasting water everywhere. You can have the fanciest mop, the best techniques, but if you don't turn off that tap first, you're just fighting a losing battle. You'll never get the floor dry. So, that brings us to the first step, tackling that root cause. In the medical world, they call this causal therapy. Fancy term, but a simple idea. It's the absolute foundation of modern wound care. You just can't get real, lasting healing unless you fix the original problem that's causing the wound. And here's where it all starts to click. Let's look at some examples. So, if the why is venous insufficiency, basically blood isn't getting back up from the legs properly, then the treatment is compression to help squeeze it back up. Or if the why is blocked arteries, well, you've got to get that blood flowing again, usually with surgery or a procedure like an angioplasty. And with diabetes, you absolutely have to get that blood sugar under control. See the pattern? The point is, you treat the whole patient, not just the hole in their skid. Okay, so we're turning off the tap. Great. But you've still got that mess on the floor to clean up, right? That's where local therapy comes in. And listen, this is way more than just slapping on a Band-Aid. It's a really sophisticated set of tools and techniques designed to create the perfect healing environment so your body can finally take over and do what it does best. And this whole local process boils down to a really simple, powerful cycle. It's 3 steps. 1. Debride. That means getting all the bad stuff out. 2. Cleanse. You rinse out the wound bed. And 3. Dress. You put on the right kind of dressing to protect it, and you just keep repeating that cycle. Debride, cleanse, dress, over and over until it's healed. Simple, but so effective. So when we say debride, what are we actually getting rid of? Well, one of the biggest villains in the story is something called biofilm. The best way to picture it is like an invisible shield or a fortress built by bacteria. They create this slimy layer to protect themselves right on top of the wound. And this shield is no joke. It blocks your immune system, it blocks antibiotics, it basically just grinds the entire healing process to a dead halt. You literally have to get in there and physically tear it down. And the tools they use to do this are pretty wild. You've got your standard methods like surgical debridement, where a surgeon precisely cuts away the dead tissue. But then you've got biosurgery. And yes, that is exactly what it sounds like. We're talking about sterile, medical-grade maggots. No, really. They are nature's tiny, perfect surgeons. They only eat the dead, yucky stuff and leave all the healthy tissue completely alone. It sounds crazy, but it's an absolutely incredible way to clean a wound. All right, the wound is clean. Now we have to dress it. And this is where things get really tailored. There is no one-size-fits-all best dressing. It just doesn't exist. The whole philosophy is about giving the wound exactly what it needs right now. Is it too dry? We add moisture. Is it too wet? We soak it up. It's all about balance. So let's break that down. Is the wound super dry? Okay, we'll use a dressing like a hydrogel that gives it a drink. Is the wound really wet, just oozing a lot? Then we need something super absorbent, like an alginate or a foam, to soak up that extra moisture. And if there's an infection, or if that nasty biofilm is trying to come back, we hit it with a dressing that has antimicrobial power, like ones with silver or even medical-grade honey. Okay, so we've got two huge pieces of the puzzle in place. We're treating the root cause and we're treating the wound itself. But sometimes that's still not enough. The body needs a little more help from the outside, and that's where support therapies come into play. They help create the perfect physical environment for healing. Now, two of the big ones here get confused all the time: compression and pressure relief. They sound similar, but they're total opposites. Compression is all about squeezing. Think special bandages or socks that help push that old blood out of the leg and back to the heart. Great for venous ulcers. Pressure relief is about not squeezing. It's about offloading, taking all weight and pressure off the wound, like with special shoes or cushions. This is absolutely critical for something like a diabetic foot ulcer, so you don't keep squishing the new tissue that's trying to grow. So, let's recap. We've tackled the cause, we've cleaned and dressed the wound, we've even added external supports. What's missing? What's the final, crucial piece that holds this entire strategy together? Well, it's not a new gadget. It's not a miracle cream. It's people. It's a team. See, a chronic wound isn't just one problem. It's a problem with multiple body systems. So you need a multi-system solution. You get the best results when the vascular surgeon is actually talking to the diabetes doctor, and that doctor is talking to the nutritionist to make sure the patient is eating the right stuff to rebuild, and the nutritionist is coordinating with the physical therapist. You see, it's a whole network of experts all focused on one thing, treating the entire person, not just the whole. And really, this is the key to the whole thing. This is the big takeaway. The absolute best results come from a plan that does it all. You treat the cause, you optimize the wound itself, and you support the patient with a whole team of experts. It's that complete, holistic approach that not only heals these difficult wounds, but completely changes a person's quality of life. So by making that one simple shift, understanding that the wound is just the symptom, not the actual disease, we've figured out how to unlock the body's healing power in ways that used to seem impossible. And it really makes you think, doesn't it? Now that we're getting so good at treating the untreatable, at repairing the body, what's next? What is the next great frontier in actually regenerating the human body? Something to think about. Thanks for joining.